live in HD. WDEF News 12 this morning starts now.
If you have varicose vein questions, hop on the phone lines at 756-1212. We'll answer those with Dr. Coates when we come back. 756-1212 is the number. The phone lines are open. Good morning. We're answering your varicose vein questions right now with Dr. Griffin Coates. Give us a call at 756-1212 if you have questions. 756-1212 is the number. Thanks for joining us.
Well, thank you very much for having me.
Who gets varicose veins and why?
It's pretty common in people that have a family history of varicose veins. A lot of times this is hereditary. People that are overweight have a higher chance for having varicose veins. Women have a higher chance, especially during pregnancy or after pregnancy. And people that stand a lot, salespeople, factory workers, or people working in healthcare fields.
Obviously they're unsightly, but are they dangerous?
They can sometimes be. They can. You can have clots that develop in the varicose veins themselves, and occasionally those will extend into the deep veins, and the deep vein clots are the ones that are actually more dangerous because those could extend and break loose, go to your heart and your lungs. Sometimes the varicose veins will bleed if they erode through the skin, and in some people, if they've had them for a long time or vein problems, the skin can actually break down and you get huge ulcers in the skin, which can be a chronic problem and very difficult to treat.
Let's go to the phone lines where Pam has our first call in question. Hi, Pam.
Hi.
How can we help? Good morning.
Yes, I'm about 45. My mother did have varicose veins. I have some, well, actually a lot, mostly at my knee and ankle joints. Some stick out profusely, and some just look like webbing all over. They do hurt at times. Do they need to be treated?
Yes, ma'am, probably they do. It's very easy to diagnose the root of the problem with an ultrasound, which is a painless procedure. It can be done in the office to diagnose the root cause of the problem. And a lot of times the treatment can also be done either as an outpatient setting or in the doctor's office without the need for a general anesthetic, so you don't have to be put to sleep for it. And long-term problems can occur from it, such as bleeding, as we mentioned, or sometimes the erode through the skin. So at your early age, I would suggest getting some good treatment for it. You can wear some compression stockings that help relieve some of the symptoms, but they don't take care of the root problem. So yes, ma'am, you do need to be treated.
756-1212 is the number to call if you have questions about varicose veins. And as far as the treatment is concerned, is it painful?
No, not really. We've treated some patients and they say it's easier getting the treatment for this than going to the dentist, because this can be done with local anesthesia. People, like I say, people don't have to be put to sleep. Some people fall asleep while we're doing it because it's so painless, but it's relatively pain-free.
Cosmetically, what are the results?
Usually within a few weeks, the bulging varicose veins are gone. And so there's not only a cosmetic improvement but a physical improvement too, because the legs feel less heavy, less tired. It's almost like taking 5 or 10 pounds of ankle weights off, because you've had this problem for a long time, and sometimes there's some symptoms that you don't recognize you have until actually it's gone.
Here's the information. If you want more information about varicose veins, go ahead and give Dr. Griffin Coates a call. Remember, talk to your physician before making any health care changes, and stay with us. We'll be back.